Okay. So greetings, everyone. I want to welcome you. Got a few more people coming in. My name is Kristen Gracer, and I am a midwife and also program officer and consultant with Amanda Kosler and OCA and Dow Funds. And I am sitting in for Betsy, who is traveling with Nakenya, and will be joining us at the next session again. So I will start by welcoming you here to the Funders Birth Justice and Equity Monthly Learning Series. It's a series in which we learn from people in the field doing the work of birth justice and equity, and from our funder colleagues supporting them. Today, we have Theresa Watson and Michelle Gutiérrez, who lead the WK Kellogg Foundation's Maternal-Child and Health grant making in New Mexico. Theresa and Michelle will present on the Kellogg Foundation's recent evaluation of its MCH work in the state of New Mexico, which includes findings on a pathway to equity and in maternal and child health. So I want to turn it over to Michelle and Theresa, and thank you so much for being here today and sharing with us.
Yeah, thank you all. Good afternoon. Muy buenas tardes. I'm Michelle Gutiérrez. I'm a senior program officer for the WK Kellogg Foundation team in New Mexico. And I'm here along with my wonderful colleague, Theresa Watson, who is also a program officer for the New Mexico team. And we'll share a little bit more about ourselves in a minute. But before we get started, we did just want to thank the funders for birth justice and equity and Betsy for the invitation. It's always an honor and a privilege to be able to share the work, the exciting work that's happening in New Mexico. And we also just want to thank all of you for being on a call on a Thursday afternoon. I know it's lunch for some of you. Late afternoon for some of you. So I hope you have some food or a lovely cup of caffeine or some tea, but just want to thank you for being in this virtual space with us. I'm sure you're already aware of the Kellogg Foundation because you know our wonderful colleague and friend, Monica Beltran, who participates in this group. So what I will emphasize is that we support children and families so that they have the conditions that they need to thrive. Today, we are humbled to share with you the high-level findings of a report that we published late last year in partnership with many of our grantees, which is called, and it's a bit wordy, Advancing Racial Equity in Maternal-Child Health and Addressing Disparities Through a Reproductive and Birth Justice Lens. And really, at the end of the day, it's just about celebrating the incredible work that New Mexicans are doing in the birth justice space. And also recognizing that if we use a reproductive and a birth justice lens that centers racial equity, then all of our babies, all of our mamas, and all of our birthing parents in New Mexico will have what they need to thrive. It's not lost on us that many of you in this room do this work every day. But as you know, outside of our space, we still have a long way to go to get folks that are on board so that everyone doesn't see birth just as a medicalized event, but really as the sacred life event that it is. And we want to make sure that choice, options, and culturally safe care are the norm. We're going to go through our presentation. We will try to fly through it, and that way we can leave time at the end for questions. But if questions pop up as we're moving through, just add them to the chat, and then we'll make sure and go through them at the end.
Thank you, Michelle. Can everyone hear me? Yeah, okay, great. Good afternoon, everyone. My name is Theresa Watson. We're so excited to share the groundwork and highlights of this report with you all today. In 2015, our evaluation team assessed our New Mexico maternal and child health portfolio. The report revealed that we focus on MCH health, but not enough on racial equity. For example, Kellogg has supported and still supports baby-friendly hospitals, yet there continues to be racial disparities. Simply, our maternal and child health outcomes are not advancing as we had hoped. This prompted us to center racial equity and birth justice this time around in this report. We knew that our grantees in New Mexico could inform our grant making and help us to capture key findings and best practices that go beyond our WKKF investments. So our evaluation team, the New Mexico Research Evaluation and Learning Team, or the REAL team, designed a set of open-ended questions that you'll see in the report. We wanted to understand the full ecosystem that grantees operate in, not just WKKF funded work. So the historic data and content in this report really reflect our grantees' comprehensive work that's supported by multiple partners and funders, including the WK Kellogg Foundation. We can go on to the next slide. So now we'd like to introduce ourselves. So Theresa Watson, Michelle Gutiérrez. I identify as Dene, and Michelle identifies as Chicana. We're both moms who gave birth in New Mexico. We both experienced challenges in our birth around cultural safety and medicalized care with our C-sections. We both had a supportive network of family and friends, and we both were able to engage in family and cultural traditions. But all of that was outside of our medical care. When it came to doctor's visits and our actual deliveries, we both felt like we didn't get the birthing experience we had hoped for. We do this work not just because it is a part of our job, but because it is a part of our community, but because we are a part of this community and this issue. We cannot separate ourselves from this work that we do. Our experiences are not unique. The report findings highlight the stories and data of many birthing families who have had similar experiences. Moving on to the next slide. So now I'll share some data points about New Mexico, and some are pretty stark. Our lands and our people have experienced 3 waves of colonization, first from the Spanish government, then the Mexican government, and finally the US government. Geographically, New Mexico is largely rural. 26 of the 33 counties are considered rural or frontier. 30 of 33 counties are designed as health professional shortage areas. In fact, 1 of every 3 counties in New Mexico is a maternal health desert. We have a population of 2.1 million, pretty small. About 60% of our population lives in rural communities. We have a majority minority state. I'll let you read all the bullet points for the population breakdown. There's a widely accepted misconception about the racial makeup of New Mexico called the tricultural myth. That implies that Indigenous, Latinx, and white people live here in a harmonious and interracial community. That's not the case. Not only does this myth ignore the current and historic racism and disenfranchisement that the Indigenous and Latinx communities experience systemically, but it also inherently removes Black and APINH peoples from the narrative entirely, and it overlooks injustices and needs of our communities. The next data point is that there are 23 federally recognized tribes throughout the state. We have the 4th largest Native American population in the US and the 2nd largest Native population by percentage after Alaska. We are still here. In 2020, 54.4% of births were covered by Medicaid. That number is now estimated to be about 65%. In New Mexico, the maternal mortality ratio for all women is 28 deaths per 100,000 live births, which is higher than the US average. Consistent with national trends, our Black and Indigenous women in New Mexico experience worse birth outcomes than their white counterparts. In New Mexico, the number of observed deaths in Black women is 4 times higher than expected based on the MMR. Black people are currently only 3% of the population, but they have the 2nd highest maternal mortality rate in our state. In New Mexico, Black African-American women are 2 times as likely as white non-Hispanic women and Native women to have low birth weight babies. Black and African-Americans are roughly twice as likely as their Asian or white counterparts to experience an infant death. In 2019, 65% of women in New Mexico received first trimester prenatal care, slightly higher than the 2009 data, but still below the national rate of 77%. And of course, the pandemic has had major negative effects on prenatal care, including the closures of multiple labor and delivery wards. I want to acknowledge that some of these talking points come directly from our grantee proposals. We definitely highlight and want to value their voices and their expertise. So although we thrive in our diversity, our connection to the land, our beautiful traditions, there's no denying that our maternal and child health situation here is dire. Next slide. Well, not everyone is a parent. Everyone has a story of when we were born. We have all been birthed by someone. We're posing some questions to consider as we move through the presentation. Michelle will put them in the chat. And they're here to help us remember and honor our birth stories so that we can keep them close as we do our work. We invite you to share the story of when you were born in the chat.
And Theresa, I'm sorry, but since I'm sharing, I can't pull them. So
Oh, okay, yeah, I'll copy and paste them over.
So in terms of methods, we collaborated with 12 of our grantees that you see are listed here. Our third-party evaluators that Theresa mentioned, the New Mexico REAL team, New Mexico Research, Evaluation, and Learning team, they conducted a secondary literature review, pulling from research articles and journals, as well as community-based resources. They also conducted about 1 to 2 interviews with individual grantees, and then they took all of that secondary literature research with the interviews and they put it all into a draft, which we provided back to the grantees in advance by email so that they could do initial revisions. And then we met with all of them in a sharing circle to get additional feedback and thoughts, just to make sure that we were getting the report right. So there were 4 overarching findings in the report. Some of them, are no-brainers, and some of them may be new to you. But there were the 4 findings and then very specific practices underneath. So the first finding was identifying equity practices to improve maternal-child health access and care. The first practice was truth-telling, so providing the historical context of birthing for communities of color. Grantees expressed that this was the very first step to addressing equity in maternal-child health field. And we know that these critical conversations on the history of colonization and its impact on the communities of color are not taught in our schools. Surprise, right? And if we're lucky in the university or in some of our professional schools to find that content, then we're able to access them. But we know overall, this is not being taught anywhere. And so for me, this was probably one of the most important findings. We have to understand where we come from. We have to understand our history and how we got here. And an example of that is the incredible midwifery collective that we've had, this history in New Mexico over millennia, and how that has changed and shifted over time. We're still quite lucky in New Mexico with the midwifery care system that we have, but we've seen that transition to a medicalized system, that system that Theresa and I have both experienced. So the history really is important. It explains our current system and some of the areas that we find is broken. And when we do the truth telling, we can heal and we can make ourselves and our communities whole again. The second practice was reclaiming traditional birthing practices. So grantees expressed that the medical model of care that we currently have does not align with an ideal inclusive system of care for birthing services. A system of care means that midwives, doulas, home visitors, lactation consultants, and other birth workers are included in the healthcare system, and they're not seen as separate. We know that particularly for our Indigenous communities, but for many of our communities in New Mexico, ceremonies, traditional medicines, and cultural practices are important to us. They feed us and they're necessary for a sacred birth. The third was culturally and linguistically appropriate practices. So grantees emphasize the importance of tailoring their services to culturally diverse families, using culturally appropriate content and approaching families and community partners in a way that focuses on their beliefs, on their family and community teachings, and on their cultural, social, and environmental norms versus our own that we impose. The fourth is gender equity. So due to discrimination and heteronormativity, often our LGBTQ plus spirit families are unacknowledged in the maternal and child healthcare systems. And we know that these systems already impose structural racism, furthering early childhood disparities. The fifth was payer systems. So grantees discussed, for example, the challenges of Medicaid reimbursement for lactation consultants, for doulas, and for other birth work services. And that's already in addition to challenges that we've heard from families that are experiencing issues with things like hospital billing, being overcharged, or navigating what their insurance will cover. And then the sixth practice was meaningful data representation. We need more consistent and inclusive maternal child health data specific to New Mexico, and that data needs to be aggregated by race. Grantees also expressed real concerns about standardized assessments, where we're standardizing everything and then we're no longer sensitive to cultural, family, or community norms.
So the second finding discusses the importance of having a diverse and inclusive MCH workforce because representation matters. Grantees affirmed in order to help advance equitable services, healthcare systems need to recruit and retain a healthcare workforce that represents the linguistic and cultural aspects of each unique community. This finding also highlights the need for equitable pay for doulas, midwives, home visitors, and other birth workers of color. Grantees talked about structural racism and barriers to providing equitable pay for birth workers, as well as getting more people of color trained to become doulas, midwives, or lactation consultants. Next slide. And the third finding provides context for how grantees are collectively creating policy and systems change. They are navigating institutional systems change together. Their collective efforts are contributing to policy, system, and environmental changes within maternal-child health. And grantees have organized to successfully inform policy changes and have made environmental programmatic changes to amplify people of color voices. 2, they engage in collaborative community-driven efforts. Our grantees have organized and come together to address different institutional barriers, push policy changes, and provide consistent education to advance equitable opportunities for birthing families in New Mexico. And 3, they inform and shape policy. Grantees provided data, evidence, and testimony during the 2021 legislative session that resulted in some positive policy outcomes that address issues of racial and gender equity and reproductive and birth justice. These outcomes empower and place trust back into the hands of women who make their own reproductive healthcare decisions. Our grantees know the power of their collective voice, and they have been instrumental in shaping the political MCH landscape in New Mexico.
So the final finding is actually a visual. It's a visual articulation of the systems of care model that our grantees described in the report. And I want to just be clear that, this articulation doesn't mean that Kellogg funds all of the parts, but it was really important for us to understand the full ecosystem and all of the elements. I also just want to acknowledge Beverly Gorman. Anytime we do this presentation, she is a Diné woman who was part of the New Mexico Real team that designed the report. And it was her gift to be able to hear everything that was coming back and then to translate it into this beautiful diagram. So I am going to try and break it down with various elements. Let me see if I can find a little pointer thingy. There we go. All right, so there is a lot here. Just be patient as we kind of walk through it together. So first you will see the yellow sun peeking out behind brown stars in a blue sky. In the center of the sun is the birthing parent and the child. Starting in the east to the right, and this is where many of our Indigenous communities start their day in prayer, we begin with reproductive choices, and then we move through the various moon cycles, illustrating the many stages of reproductive, birth, and family and infant care. From reproductive choices, we move to prenatal care, to birthing support, to postpartum care, to breast and chest feeding, to 0 to 1 years infant care, 1 to 3 years toddler care, and then birthing families, wellness, and care. Coming back to the brown stars, we see the grantees' racial equity work positioned within each ray, which metaphorically represents the sun's heat source. The grantees are strengthening this heat source to advance racial and health equity through spiritual, policy, and environmental changes, to health and well-being, mental, behavioral, and social changes, and then to birth services and economic opportunity. All of this racial equity work is part of a holistic perspective that radiates towards outcomes, which are all of these ones on the yellow outer rim. The outcomes that we hope to see are access and duration to breast milk, decrease in ACEs or adverse childhood experiences, healthy developmental milestones, increases in social supports for families, improved parental well-being, full-term births, and then a healthy birth weight. So this model initially may seem complex, and I know that it's very different from many of the other maternal child health models that are out there, but I will say that this model fits for New Mexicans. It resonates with them because it was informed by diverse New Mexicans, predominantly women of color, working in the reproductive and birth justice space. And when you sit with it for a bit, I do think that this image conjures up the deep roots of culture, of history, of our connection to our land, and it demonstrates the relationships, the interconnectedness, and the interdependence of each element. And all of these are rooted in the strengths and the assets of our communities. So the last part of the report are the data highlights. So it's a separate integrated section. We asked the REAL team to pull together data highlights that were specific to New Mexico, and when possible, to aggregate them by race. So these are the data points that are presented in the final section of the report. And the data itself highlights disparities, but also the strengths and assets that we can continue to build upon to support not only evidence-based, but practice-based approaches to engage and inform decision makers, and more importantly, our communities on the best ways to move forward.
So through this report, we've learned so much about how our community partners are moving forward together. Now, as we close, we invite you to reflect on how we in philanthropy will also move forward together. The question we pose to you is, what role do you play in nurturing the ecosystem? Returning to the beginning, it was important for us to highlight the racial equity components of our work. And so we ask, how does or how can racial equity show up in your work? Which collective actions can you invest in? Finally, how do we share our funding priorities and leverage resources for grantees? How do we identify and fund the gaps in our funding priorities? At WKKF, we will continue to learn from grantees and invest in the ecosystem. Our role in philanthropy is to continue to lift up racial equity, honor cultural assets, and invest in systems change work with various sized organizations. Together, we are here. Together, we are committed, and together, we are moving forward. So here is our contact information, and we invite you to connect with us.
Thank you so much, Michelle and Theresa. And now I'd love to open it up to any questions if anyone would I don't see any questions in the chat so far. So why don't we just go ahead and share your question. I know I have so many, so I'm just holding back. But I'll go ahead and ask the first question, and then anyone can follow me. So Theresa, Michelle, I was a midwife for a short period in northern New Mexico. So it really warms my heart to hear your presentation and just know the amazing work that is happening there. I'm wondering if you can just in your own words share what is really unique to New Mexico, and then what you also think can really apply to other people's work as well in their homes.
You want to go first, Theresa?
Yeah, Kristen, will you repeat that? I was caught off guard because I was looking in the chat that we found out that some people are born at the same hospital.
Oh, nice.
I was trying to find the emoji.
That's
to
great.
respond.
I know it's so
Super
hard
cool.
to not just get absorbed in people's birth stories here on the chat. So yeah, no, I think just knowing, would love to hear in your own words what you feel is unique about New Mexico and the study, and then what you think is also that other people can take into their work from the places that they are working towards equity in maternal and child health in their homes.
Yeah, thank you for that. I think what's so unique, especially about New Mexico and our grantees here, but even beyond that, beyond just the communities that we're investing in, but all of communities in New Mexico, is just how deeply rooted we are in traditions and cultures. Whether we've been here for, generations, or if our neighbors have recently arrived to the area, everybody brings their full selves into this work. And so that really showed up in the data. It really showed up in the stories. And there's a real urgency for us to revitalize some of those traditional birthing practices and to lean on what we know is like ancestral sacred knowledge that can help heal us. And so there's just this really strong spirit and purpose to the work that I feel like everybody collectively brings. And that's why I was just so like proud of the model, because I feel like that captured it in such a beautiful way. So.
Yeah, I would agree with Theresa. I mean, I would say it's not unique, but New Mexicans have had the fortune of preserving some of our traditions and history of birthing that other communities, they've already been removed, right? And so then there's, I would say to a certain extent, a little bit more work that needs to be done. But the culture, I mean, all of us have beautiful cultures. We all have traditions and medicines. We've just been very fortunate in New Mexico to a certain extent to preserve those. And then just in terms of learning, I think just going back to that very first practice around truth telling. I mean, we emphasize it all the time within the foundation. It just gets missed, it gets lost. And we see this disconnect, particularly with our medicalized system and our doctors, our OBGYNs. They don't know the history of how of how colonization has also shaped our birthing spaces right now, right? And that's part is so important because if we don't tell that story, we can't get to a place of partnership, true partnership, right? Like what we see in New Mexico is, yeah, a doctor will say like, oh, okay, there's doulas. It looks like it's extra support. Midwives, all right, bring them in. But they're not necessarily honoring those professions and the history behind it. And so I think that's a space that we're really trying to work on. So actually, I would turn it back to you all if you have ideas. That's something that we're just constantly battling with, Theresa and I.
Does anyone have any thoughts or experiences about truth-telling efforts in their own work and maybe perhaps resistance to those efforts? Because I know there are many examples of resistance to the truth-telling, and how you've managed those, overcome them. Well, this might lead into a little bit of the next question. Terry, do you want to ask the question, or would you like me to read it?
Hi, good afternoon or morning, probably for some. I'm Terry Plain, and I serve as a senior strategist with Missouri Foundation for Health. I lead our infant mortality reduction and improving maternal health outcomes work. So I am very honored to be here. This is a great space to be in. And so we are kind of leveling off the idea of elevating community voice and advocacy really within this maternal mortality landscape. And we are seeing the need to really work outside of the traditional healthcare system in order to engage, really authentic community and communication. And so that's where these questions arise, because we want to figure out, what does this group, or what could participants look like in this type of space of truth telling and thinking about traditional ways and culturally, congruent type of ways to communicate. So that's where these questions are in terms of how are they facilitated? Are these things, is this work done through foundation staff, or is this done through other stakeholders? that may be perceived as more trusting among, among community members and so on. So that's where these lead to.
I don't want to jump over you, Theresa. Go ahead.
Okay. Yeah, thanks for that, Terry. So just to answer sort of the straightforward questions in the chat, and then we'll get into a little bit more of the deeper questions. So these conversations were facilitated by our evaluation contractor team, the REAL team. And they've worked with our grantees for a really long time, and so they understand sort of grantee work. Michelle and I met with the REAL team regularly to sort of review research questions, to really ask ourselves, are we asking the right questions? What have we missed? To really get into some of the research design with them. So it was just this really collaborative space with our grantees, with our evaluators, and with our team. I think generally, and I'll say this, with a lot of pride, but also responsibility, is that our grantees trust us. And I think it's because we've invested in different types of organizations, small organizations, to some of our larger institutions. So our portfolio is fairly small, but it's really diverse in terms of the way we approach MCH work. And what we've done is, in terms of our portfolios, we looked at the ecosystem of who works with each other and how can we lift them up? How can we lift up the work collectively so that they feel seen, they feel heard, that their work is acknowledged? And so that really helped us with the trust building. In terms of the truth telling, these birth workers and birth advocates are fierce, they're courageous, they're just beautiful advocates for this work. And so they, I feel, had no problem telling us or anyone else what needs to happen in New Mexico in terms of birth work.
Thank you so much.
Can I jump in with a question?
Mm-hmm.
Thank you so much for this presentation. So beautiful, and for the good work that you're doing in New Mexico to support ecosystems of birth workers and birth justice movements. I'm Amasa Hammond from Groundswell Fund and our Birth Justice Fund, and generally our grant making for reproductive justice nationally. New Mexico has been one of our highest funded states, and we fund a number of organizations. And I'm wondering if there's overlap. That actually was my question, because I got very deep into the chat as well at one point in your presentation. And I wondered if there's a way you could also share some of the partners you're funding in the state, just to do some mapping. And I wonder if we can also, as a group, like map who else is funding this work in New Mexico and where are there gaps and other opportunities to really strengthen just the great work that is happening in that state.
Absolutely. Actually, we will put a link in the chat to the full report, and that has the grantees. And I'm hoping this works.
Theresa, this report was done last year, and since then we've added in new folks to the portfolio. So Theresa holds a grant with Diné College on Navajo Nation, and they've started to do a feasibility around creating a doula program for Navajo women, so Navajo specific doulas. We've also funded New Mexico Doula Association for the first time. And then the UNM hospital, which is the largest hospital in the state, has what they call the Volunteer Companion Program, which are doulas that are providing support to families that don't have any support when they go in to deliver. So there's it's an incredible ecosystem right now in New Mexico to see all these things that are popping up.
Monica, I see that you've had your hand raised. I don't know if you want to jump in.
Yes, because Nat is asking about partners, and I want Michelle and Theresa to shamelessly talk about the New Mexico Doula Association, because they just finally got established. I'm not sure how long they've been working, but it's been a while. and they're going to need support. So just putting that out there. If you're looking to invest some funding in New Mexico, that would be a good one.
Thanks, Monica. So believe it or not, there was no doula association, and there are some doulas that have been working closely together almost as a collaborative. So we seed funded them to start to build out some infrastructure and organizational support. Since then, they've received a grant from United Healthcare, but are continuing to seek support. The reason that we want to strengthen this organization is that we're starting to see federal funding that is coming down the pipeline. We're also working with several groups, including New Mexico Doula Association with the state of New Mexico that is now in negotiation for doula reimbursement for Medicaid. So it's really important that that organization have, strong infrastructure in place to be able to advocate for dollars, for negotiations around Medicaid, but also just that stronger infrastructure that as doulas come into the workforce, they have the supports that they need in that membership organization.
Sorry, can I ask another question? Your presentation was so great, and just sharing about the disparities and also looking at what's happening to Black communities in New Mexico, a very small part of the population. We don't fund any Black-led organizations, but I'm wondering other folks in New Mexico, if you're funding organizations, is anyone funding Black-led work in New Mexico? That's just the area that we fund a number of the organizations on this list, but I'm curious if folks are supporting Black-led groups.
So I was checking to see if Black Health New Mexico is on the list that Michelle shared. So Black Health New Mexico is a grantee in our portfolio. Currently, we're looking at general operating support work with them because they really are doing a lot of cross-racial coalition building because they know, when we can raise the health outcomes for Black women, we raise it for all women and birthing parents. And so they've been a really strong advocate. They've also been a really key player in a lot of the policy and systems change work. So they're becoming a really key part of our ecosystem portfolio. So we do fund Black Health New Mexico. And I don't know if others want to share organizations that you might be funding in New Mexico.
I would also just share that Black Health New Mexico has taken on a leadership role in the birth justice space in New Mexico and has partnered very well with our Indigenous communities, like Tewa Women United. And they actually passed some legislation last legislative session around establishing additional Black and Indigenous seats on the Maternal Mortality Review Committee, which is huge. We've never had Black representation or Indigenous representation, and now there are seats that are carved out. And they're also required to take some racial diversity trainings. Previously, the Maternal Mortality Review Committee was made up majority of white hospital administrators. And so we're starting to see shifts in New Mexico around what that maternal mortality committee looks like and the power that they hold in our state. And so it's been beautiful to see just that advocacy work that's happening and the recognition for it.
Mm-hmm. And currently, they're leading through their collaborative work, a coalition of birth workers that are helping to design the Medicaid reimbursement for doula services and eventually lactation services. And so they're working with this with the state agency on what does that look like? How do we make sure that we're looking at payers like equitable payer systems. We're looking at just how things are not only reimbursed in terms of like the infrastructure of the payer system, but the readiness as well. So they've been a key leader in that space too.
Since we have you all in this room, I'm curious, this is a conversation Monica and Teresa and I have had, is any work that you all are doing, particularly in the healthcare systems, right? So our hospitals to improve their practices around culturally safe care. I'll just say it, we struggle internally with wanting to fund our grassroots organizations and an alternative model where their system of care is front and center, but recognizing that the majority, at least in New Mexico right now, 97% of the births are still in the hospital system. So until we can get to this, wonderful system that we're hoping for and that we're investing in with our non-profit grassroots organizations, we're leaving a lot of mamas in these unsafe spaces. And so anyway, that's the conversation that we have continuously, is how do we also start to invest in and think through getting some of these hospital systems to change some of their practices. We got to start somewhere, and we're just not sure where to start because it's a tough place.
I can maybe jump in on this one. I guess part of why earlier, when you were talking about truth telling, when I asked about resistance, it was really coming from that knowledge from my own, personal experience, though I'm positioned differently as a white midwife. There is a lot of resistance and that is a barrier to culturally safe care in hospitals. And I would say one thing about the doulas and midwives and other birth workers and support people is visibility in the system and having opportunities to sort of explore and demystify what traditional birth work looks like and really create shared language, because one barrier to collaboration is not a shared language, is that there is not a shared language. And there's no continuity, there's no translation between the two. So I think that is absolutely something that I believe that we as funders have a responsibility to the birth workers to not throw them into the fire, of really bridging those gaps in the translation barrier, I'll just call it, in order to create safe spaces, because otherwise then they end up playing defense and, taking the hit and weathering all of the effects and impacts of the abuse, obstetric abuse and institutional racism. So. Yeah, and I'm just reading here about New Jersey Birth Equity Funders Alliance. Do you want to speak to that a little bit? Sorry, I need my reading glasses to see who that was, who shared that.
Hi, that was me, Janelle. Can you hear me okay?
Yeah, I can hear you great, thanks.
Great. Sorry to not be on camera, everyone. I'm in transition. My name is Janelle Reynolds. I work with CHAP, the Community Health Acceleration Partnership, along with Raquel Maison-Jeffers and Wendy McQueenie. And we are members of the New Jersey Birth Equity Funders Alliance, and through that initiative are providing funding to the Earth app, which was founded by Kimberly Seals-Allers, who's a narrative change agent and powerhouse in this space. And they have several different hospital systems that they are working in across the country to sort of do a quality improvement initiative where they have a campaign to get birth givers who are giving birth in these spaces to leave reviews on their app, which is sort of like a Yelp review for your birth experience. You can rate your provider and the hospital experience, the lactation experience, and reviews can be led by birth givers, partners, doulas, etc. And then they're collating that data and providing it to the hospital system to say, this is the lived experience of people who are giving birth in your system. And here's the data that you need to sort of think about how we can change the experience for people. And so we are working to gather funding from other interested parties and stakeholders here in New Jersey to support this initiative in a couple of different hospitals across the state, and are really hoping to be able to launch that pilot later this year or early next.
Thank you for sharing. That's really exciting. Well, I know we still have about 10 or so minutes until the 3 o'clock my time hour anyhow. I don't know if anyone has any other questions that they want to ask or any other. I really am appreciating this opportunity to have conversation as well and share best practices. Often, we're just, it's great to sit and take in the information, learn from the work you're doing, but it's also very generative to have these conversations. So really, we have another few minutes of time together. So does anybody, please feel free to throw questions or prompts in the mix here.
I'll read out my comment in the chat that we'd love to have a follow-up or be looped into some sort of mapping exercise that shares our funding priorities and our gaps. And I think even if we aren't funding in each other's geographical locations, it would be really wonderful to learn from each other. So this is work that's happening in New Mexico, but a lot of these are best practices that can be applied to any part of the world, really, because they're just so community rooted. And then it'd also be great to stay connected, to share and lift up some of the wins and stories and challenges of our grantees and just how they're working together to address these outcomes.
And I'm seeing there's another app. Sona, do you want to speak to that?
It's not an app, but Dr. Karen Scott of Birth and Cultural Rigor has a scale, the Prem-OB scale, that measures obstetric racism. She is one of my grantees. I'm not sure if any organizations in New Mexico are currently working with her, but that's also a tool, a validated tool that can be used to measure and used for like hospital assistance advocacy as well.
So Sona, you made me think, Dr. Scott, she's finalizing the save the date. She's having her patient safety summit
Nice.
this week of December in Nashville. And as soon as that's ready, I will share with you all. And Michelle,
Okay.
it'd be awesome if you could go, because I think that we're going to have that discussion about accountability during that space. And it's the $1 million question.
Mm-hmm. Thanks for sharing that.
That would be wonderful. Go ahead, Michelle.
I was just going to say, I mean, we've dabbled in quality improvement packages for other pieces of work, but we find that folks are more on board when we have data and a tool. And I mean, it doesn't matter how many times we tell them, it's just needs to be documented. So this is cool. I mean, this is something, Theresa, we could talk with University of New Mexico about, since they do a lot of our quality improvement package work. Thank you.
It's a great resource. Just thinking about our teams. So we've been talking about like what kind of research is needed in the area and how could we, again, kind of approach this from approaching the ecosystem from sort of a multidisciplinary approach. So I was just thinking out loud, like what kind of research could help demonstrate some of this. You know, if we had a control group that said, hey, we're working with all these community partners that are putting the systems in place and the connections in place before someone gives birth. I love the way, I love that we can create these tools for our community people to give feedback, but that's always after the fact. And that's always after a birth, you know, a sacred life event. And it's just, I think we have to get ahead of it. If there was a way for us to capture just sort of the success and the care that could happen with these collective approaches, that in of itself would be just wonderful research to share.
Can I ask a slightly unrelated question? Or Kristen, you came off mute, so I want to keep that thread if.
No, that's fine. Yeah.
Just thinking about the state of New Mexico and what's happening to reproductive healthcare just generally in the country, and New Mexico being a receiving state in many ways, as states around New Mexico are banning abortions and restricting abortion care. I've heard from our partners on the ground that there's been a flood of like new funding coming to the state, flood of like new organizations trying to set up shop in New Mexico, not always doing that in a respectful way or connecting with partners who have already been there doing full spectrum reproductive healthcare, birth and abortion and everything else. But I'm wondering what you are all seeing, and if there's a way that we can connect this conversation around birth, around what's generally moving in the state of New Mexico, given what's happening to abortion care in the US.
What you're saying is all true. I mean, thankfully, we are considered a sanctuary state and a safe haven. So abortion care is still legal. The legislature reaffirmed that in the last session. I'll look for the open letter. Bold Futures and a couple of other groups had put forward an open letter with concerns. We are seeing a lot of abortion clinics that are opening up but have no ties to New Mexico whatsoever. So it's not that we don't welcome abortion care, but there is some tension because of the way that folks are setting up shop, not partnering, not navigating. And also it kind of bleeds into the payer systems, right? So the majority of folks in New Mexico, we access Medicaid care and those dollars. And so there's just some payer entanglements as well. I know Bold Futures is working on that quite a bit. I think Strong Families New Mexico as well. Again, we're happy that at least we're a sanctuary state, but we are seeing a significant influx of providers and then folks that are trying to access abortions from a variety of different states. I don't know if Theresa, you have anything else?
No, just echoing and lifting up Bold Futures and Forward Together as well. And so when I was referencing Black Health New Mexico and their collaborative, which includes a lot of these organizations and grantees that we were talking about, when they're talking about or trying to inform what Medicaid reimbursement looks like for doula and lactation care, especially doula care, they want it to be full spectrum care, regardless of the outcome of the pregnancy. And so inserting that kind of language and practice into policy work is going to be really key, just to kind of help, one, shift the type of care people are getting, and then two, what's needed. And so if there are sort of outside groups that are coming in just to perform a procedure, our communities are saying that's not what we need. We need full spectrum care. We need more comprehensive care. We need more collaborative effort. And so the more that we can lift up those voices, the more we can color in this this sort of contentious, I guess, issue.
Thank you for that question, Na. Well, as we're getting close to wrapping up here, does anyone have any final questions or thoughts? Well, and so Theresa and Michelle, thank you so much. I don't know if you have anything that you just want to share as we're closing here. It looks like we have more conversations to have in the future, that in a way this is really just a continuation of the work, but the beginning of what sounds like some really great ideas that have come out of this conversation. So I look forward to continuing this conversation with you.
Kristen, thank you for stepping in for Betsy.
Yeah, thank you. For those of you, many of you we haven't met, but I'm one of the newer collaborators here with Birth Justice and Equity. So this was a big step for me, but I'm really excited and happy and honored to do it. So, you know, as we wrap up here, I just want to thank you again, Theresa and Michelle, for a wonderful presentation. Thank you, everybody, for attending. Next month, the monthly learning presentation will be Thursday, May 18th, and there will be joining us presenters from the Burke Foundation. Findings of their report. I saw today we have some folks here from the Burke Foundation. The findings of their report, Delivering Better Care, Midwifery Practice in New Jersey. So I look forward to seeing you all, and I'm pretty sure that Betsy will be back next month, but I appreciate this opportunity to spend this time with all of you and hope that you have a beautiful rest of your day. And thank you for the energy that you put into your work, and thank you for being here and sharing.